from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Kevin Stansbury is a respected healthcare executive and passionate advocate for rural health, currently serving as Chief Executive Officer at Lincoln Community Hospital and Care Center in Hugo, Colorado. With decades of experience across hospital operations, business development, physician relations, and healthcare strategy, Kevin brings both executive leadership and a deep understanding of the real challenges facing rural communities. What stands out about Kevin is not just his experience, but his willingness to speak boldly on behalf of small hospitals, vulnerable patients, and the communities that depend on them. He understands that where you live should never determine the quality of care you receive, and he has become a strong voice for protecting access, improving policy, and creating sustainable solutions for rural healthcare. With a background that spans healthcare management, project leadership, business development, and even law, Kevin offers a unique perspective on what it takes to lead through complexity, advocate with integrity, and fight for the future of community-based care. Please join me in welcoming Kevin Stansbury to the Missing Piece podcast. Thank you for being here. We really appreciate it.
Thank you for that kind introduction.
Of course. I'm really excited to get to know you and to talk about how you got to where you are. But to get us started, introduce yourself. You haven't always been the CEO, I'm sure, but how did you get started? Tell us about who you are.
So thank you for that. I've really had a blessing of a career in that I've been able to work in a number of different settings. Most of my career, I worked in community hospitals of various sizes, and not necessarily pure rural communities, but suburban communities and larger rural communities. I took some time then and worked in consulting and helped hospitals around the country to plan and then construct new facilities, whether they're replacement hospitals or whether they were additions to existing facilities. From there, then I got back into operations again. What really, April, the defining moment for me was I had an older brother. I was very close to him, and he passed away suddenly. And I remember talking to my wife, wow, is that all there is? I love my job. I love what I'm doing, but it's kind of the same thing over and over again. What happens to when you get to a certain point in your career? And so at that point in my life, I had an opportunity to go to work internationally and got the chance to work with a couple of really great people. We worked in places like Vietnam and Nigeria and Ethiopia. We were working to try to redesign the healthcare system in Libya after the revolution. I had an opportunity to work in Botswana for another consultant, and I just fell in love with the mission of it. It really brought back the mission, why we do healthcare. When this position at Lincoln opened up, I was actually considering relocated to Vietnam. My wife and I were looking at a position there, and we talked about it. And we have a grandson, or did have a grandson, who lived in Denver, which is only about this way. And really decided family was important, and I could fulfill my desire to have a mission in healthcare by working in rural healthcare. And the mission is very, very simple. We're dealing with extremely scarce resources. We're dealing with marginalized populations. We're dealing with long distances to travel. And that really appealed to me. And I tell friends and colleagues all the time, this is the hardest job I've ever had, absolutely the best job I ever had. It goes back to that moment when I heard my brother died, and I thought, man, I really want to do something more meaningful in my life. I want to make a difference. And rural healthcare, to anybody that's listening, that's contemplating going into rural healthcare, is an excellent opportunity to make a huge difference.
Wow. I'm already inspired. By the fact that you were moved by what was possible and then pursued a career on how you could have impact. I'm really sorry to hear about your brother's loss. I can't imagine. Thank you for sharing that as well. So looking back at your journey, I call those sliding door moments. Do you feel like that was like that pivotal moment for you where you were like, okay, yes, I can continue consulting and being on this career path, but how do I make a big impact? Was that kind of like what really moved you more than anything to the role that you're facing today? Do you feel was that pivotal moment?
Absolutely, I really do. And I think for me, it was, and I didn't appreciate it as much. One of the really cool things about rural April is the ability to really get close to your staff. We're a small group of people.
Yeah.
My hospital, we employ just a little over 160 people. I know everybody. I can walk down the hall and I can greet almost everybody by their first name. I know what's going on. When
Mm,
you're in consulting, and I loved doing that work, I love the different dynamics and the different challenges. But the difference is you're never really part of the family. You're an outsider. You're coming in to solve a problem, and then you move on. In small rural hospitals, we're all really tied to our mission, and we're working very closely to make sure we're completing that mission.
I love that. I absolutely love that. So we did a little bit of homework and we realized that your hospital is about 80 miles from the next nearest facility. How does that level of, I don't even want to call it isolation, but it is being far, impact your operations, the decisions you have to make? How do you talk to me more about that?
We take it very, very seriously. And so, for example, if our services aren't here, there's a 100% probability that we'll have somebody present to our emergency department today needing life-saving care. And if we're not there, they have over an hour drive to get to the next closest hospital. And so we take that very seriously, that not only do we have to be there, we can't just be there. We have to be there for that patient, for that individual. One of the really cool things about rural is the idea that, the people that we're treating, our chief nurse always tells new nurses to our hospital, we don't just treat and street people, because you'll end up running into that same person in the grocery store or sitting next to them at the football game on Saturday night, or out on a walk around town, and you're going to encounter people. And so it raises that level of responsibility, because there's no anonymity in rural healthcare. They know who you are, they know what you do, and they know how you treated them. And that really raises the expectations that we have on the kind of care that we try to provide. The second piece, and you said it in the open, where you live shouldn't determine how you live or if you live. And we are very concerned about that idea of the rural tenalty. There's been an increasing number of academic studies that talk about life expectancy and how life expectancy in rural areas is dropping compared to urban areas. Incidence of chronic disease, number of different preventable diseases are at a higher rate in the rural areas than they are in urban. I think that's in part because of the isolation. So again, we have to take that very seriously. We'll work really hard to raise the relative health of the community.
Wow. I actually live in a big city. And to your point, if I need medical attention, I am just a number. I'm just another patient. So I love your response and the fact that you're not a number. You are, they know you and they're going to see you. And you know that your job of caring for them is to give them 110%. That's really special. I love that. So I know Colorado has initiatives for rural initiatives that they're doing. Colorado Rural Future Projects, I think, is one of them. Can you tell me more about that?
That has been it's an exercise in passion right now for the last couple of years for several of us in the state. We started out, there were 6 rural CEOs, and we all kind of shared the same passion for what we did, but also this idea that it's really easy to start admiring the problem when you're constantly challenged. Well, here's another problem. What do we do about it? And our motto is stop admiring the problem and start developing solutions. And so what was really cool, we all got together. We sent out solicitations to every hospital and big health system in the state. Every hospital supported us financially. We were then able to get a very generous grant from the Colorado Health Foundation. And then we were able to hire the Farley Health Policy Center at the University of Colorado to do a study, because what we were looking for was, let's get some data. And what we wanted to understand was, what are the root causes of financial and operational stress for Colorado's rural hospitals? And then how do we address that? We're just now completing our report, and our plan is over the next 3 years, we want to develop a policy roadmap that we can take to policymakers, focusing primarily on the state, but we'll have some federal initiatives as well. Talk about what we need to do to preserve access to rural health care. Most people right now are sympathetic to rural health care. I've never gone in, whether it's in DC or Denver or anywhere, and talked to anybody and they say, we don't care about rural health. Everybody cares about it. They just don't know what to do about it. And
Right.
I would suggest to you, this is not my idea. I learned it from a meeting we were at talking about the future of rural healthcare. Somebody suggested rural healthcare is truly, it's a national security issue. And that seems overly dramatic, but when you think about it, in rural areas, that's where we produce our food. That's where our clean water comes from. That's where most of our energy comes from. That's where people go to recreate and relax. Without rural healthcare, rural communities start to shrivel up and go away. And then we don't have that population of folks living in the rural areas that support those vital functions for the rest of the country. So we're all very passionate about it. Again, it's a grassroots effort supported by, I'm so proud to say, by every hospital in the state supporting this.
That's awesome. That's really, really neat. And again, if anybody wants to look into that a little bit further, it's called Colorado Rural Futures Project. So it's just awesome. Well, moving to talk about technology, AI, and do you think there's a technology divide between the rural hospitals and the urban hospitals? And if there is, do you have any concerns in regards to that? Are there any technology gaps that you see?
I think it's a huge concern, and I think that's our next frontier. One of the opportunities I have right now is I serve as the chair of the eHealth Commission at Colorado. And we talk about that issue a lot. How do we bridge that divide? The big systems in the urban areas, they have the resources. Many of them are developing their own AI, for example, or they're able to customize their electronic health records in a way that really fit their process. In rural, we talk a lot about vanilla. We don't have the resources to continue to update or change the system. We accept the system as it is. We change our way of doing things. But we also don't have the resources to invest in new add-ons to those systems or develop new technologies like artificial intelligence. So we're kind of lagging behind. We wait till, it's that, and all technology hits that price point that suddenly all the masses can pay for it. So we're lagging behind on that. I think that contributes again to that rural penalty that we talked about earlier. And that's one of the reasons I'm really excited about the Rural Health Transformation Program that through HR1. That will allow us to get that money to invest in new technologies to really support rural providers. And I want to say, and I hope this is an okay place to put this in, there's a lot of folks that will argue for, well, all we have to do is get high-speed internet in the rural areas and everything will be okay because we'll do everything by telemedicine. I suggest to you that's wrong. If you roll your pickup in my county, an avatar is not going to save you. You need an in-person care to come get you, bring you to a location where we can care for you, either stabilize you and discharge you, or stabilize you and transfer you for definitive care in the urban areas. There are a lot of things that will help with technology, but we still need an adequate supply of competent caregivers in our rural areas to take care of our patients. And it's not just the dramatic stuff like trauma, it's the ongoing management of chronic disease. It's primary care, having those folks that develop that relationship with their patients to really give excellent care. So I think we have a risk of falling behind on technology. We also have a risk of kind of saying, don't worry about them, we can do it all by technology. When in fact, one of our greatest strengths is our person-to-person connection, like we talked about before. So let's supplement that in-person care with technology, not try to supplant it.
I love that. And I couldn't agree more. And I think, if you have too much technology and too much money and too many resources, that almost drowns it out. And instead, you've had to flip it upside down and say, no, how do we work with what we've been given? And then, yes, if we can get some grants and we get some funding and we can, make things more efficient or more effective using technology, then let's do that. But let's not put that in front of patient care, So I love that. I really love that. You think a little bit different. And let's be honest, Kevin, it's a little bit scrappier. You know what I mean? When you don't have the resources, you look at things differently,
Right.
It's like, I'm kind of glad that I don't.
That's right. And somebody once told, we have a group of our small hospitals out here on the eastern plains of Colorado, and somebody once told us, you guys are rural enough just to, you can just figure it out because You do with different resources. We're very nimble. Most of us are not affiliated with systems. So I don't have to call Dallas or Nashville to ask permission. I go to my local board. We're able to make decisions faster and really keep that focus on the mission to serve the community. And I think it's a great
Yeah.
combination.
Yeah. Well, I have read that in and with rural communities, there's board members that obviously have like maybe their personal agendas or even limited healthcare knowledge. How do you, as the CEO, navigate the dynamic? And do you believe this is true across most rural communities when you have a board that's coming with their agenda and you have yours? How do you navigate that as a leader?
April, that's a great question. And actually, that's one of the primary issues we identified in Rural Futures is how do we support our local governing bodies to help them understand what's their most effective role? One of the things that is unique about rural is, again, many of us are independent. So we still have our own community board, which is very different than the big urban systems. Every hospital is the CEO of that hospital may report to a VP of operations who reports to somebody else and somebody else. I'm directly accountable to my board. I have a great board. I've really been blessed by that. But we spend a lot of time in education. We talk about the fundamentals, the difference between governance and operations. They stay in their lane. I stay in my lane. We have an excellent relationship. And that takes a lot of open communication. It takes training on the complexities of rural healthcare and healthcare in general. I had a board member one time tell me, well, look, you guys are no different than the bookmobile. This is simple stuff. And after working on the board for about 6 months, it came to me and said, I had no idea how tough this is. And so you bring in the owner of the local feed store, the hardware store. Their business model is very, very different than what healthcare is, and particularly rural healthcare. And when you tell them more than by design, in our case, it's 75% of our business, we're not going to cover our costs on that business. We've got to figure out ways to sustain ourselves, knowing that we're going to be underpaid. So how do we do that? That blows a lot of people's minds. Now, when you are bringing on new board members, I think one of the things that is the secret to a good board is good board leadership and having stability in those leadership levels. Our board really does a great job of orienting and bringing in new board members and sort of setting parameters for where we go and what we should do. And I think it also takes that ongoing trust with leadership that they trust me, I trust them, and it's a real partnership. Final point I'm making is very much related to that. One of the big challenges we've discovered in our Rural Future study is the turnover of rural CEOs. Nationwide, on average, it's about 30% turnover. On the Eastern Plains of Colorado, we did a study a couple of years ago, over a 2-year period, we had a 63% turnover rate. So we also need to do a better job of identifying leaders for rural who are going to become invested in the community and want to stay there more than 18 months, which is kind of the average tenure right now, to build stability, to build an internal leadership team to work with. So it's a joint responsibility between the board and the executive, and it can be done. It's done in a lot of places. There's also a lot of places because of what you said. Somebody comes in with an agenda, whatever it is, and then there's turmoil on the board, there's turmoil between the board and the CEO, and all that does is it really threatens the viability of the organization.
Yeah. So taking that even to the next, you're making me think about your staff and your culture and your physicians and your clinical team. How do you retain your talent so that they're not, you had mentioned the executive turnover, but what about, the clinical turnover? Do you face that much, or have you built a culture where you can retain them a little bit longer from, your hospital in and of itself?
Yeah, that's a really great question. And I disagree with many of my colleagues and many policymakers who think we ought to pay clinicians a bounty to go to a place and stay there for 5 years and then we'll forgive your tuition loans or whatever. I think all that creates is somebody making talk marks on the wall saying, well, I only have 2 years left, 1 year left. Now I'm out of it. What I really try to stress, and we've been reasonably successful, is let's recruit for people that are a cultural fit. We are very open. The nearest Walmart, for example, April, is 60 miles away. So you can't hire somebody who wants to, do a lot of things and have a brilliant nightlife or whatever. We can do those things, yet you just have to travel a little bit longer to do them. We want people who want to raise their families in a rural area. High school sports is the big deal in our area. Become involved in the community. Be part of the different civic groups that we have. Really invest in making our community better. I think that can be done. We've been successful, well predating me. When I came here, our two primary care physicians at that time had both been in the community over 30 years. I've been here now going on 12 years. One of them has retired at over 40 years of service to our community. The other one, he's bound and determined he wants to beat Mark's, the retired physician's record. I have two new primary care physicians that have come in. One of them, she's been in our community for over 7 years now. They're doing great. And she helped us recruit one of her medical school classmates because we really do emphasize culture. The last point I'll make, you asked briefly about other senior leaders on our team. We have a leadership team of 5 people, myself, a CFO, chief nurse, a clinic administrator, and a chief operating officer. My chief nurse, my clinic administrator, and my chief operating officer were all born in this hospital. So they really
Wow.
and we are very intentional about culture. We can't always pay and compete with the big urban systems on compensation, but we will overcome them every single time on culture. And what can we do to have a good culture? Give people education, help them do more with their license. So they're working at the top of their license and make them feel respected. We're not perfect. No one is. But I think it's just that issue of being intentional about what can you do to improve your culture. I consider that, frankly, my number one job, making sure we have the kind of culture that people want to be here. And I think that's really.
So that was kind of one of my next questions, which you just did a great job highlighting it, is, being the CEO of a hospital is no small task. You're responsible for a lot. Just, the younger generation or even an executive that's looking to be the CEO of a hospital, be it rural, urban, any type, if their path, they think, I want to be a CEO one day of a hospital. What's your words of wisdom? What advice would you give them?
One of the best pieces of advice I ever got was, first, understand what your personal mission is and make sure that aligns with whatever organization you're looking at. And then second, be grateful for that. So we sort of talked earlier about the Colorado Rural Futures and not admiring the problem, look for solutions. In every situation we face in life, there's something there to be grateful. And I think it's important for young leaders or leaders of all ages to retrain our minds to look for what's the next opportunity. We certainly don't want to be blind to threats. I'm not suggesting that at all. We want to be realistic about those. But we can't be overwhelmed with the threats because it's real easy to reach burnout if you're doing that. So we look for those little victories. We look for ways to say, hey, can I bring this service to our community? We're very soon going to be maybe one of the smallest hospitals in the country that'll have a urogynecologist come and visit and do care for our patients. That's huge for us. And we're all excited about having her come and join our team. We have to be bold and nimble and try new things. One of the greatest compliments our hospital ever got, I was watching, we have a hospital service. We had a young physician who was doing a presentation at a statewide meeting. And they asked him, what was it like? Because he works in the city and he also works out here. And they asked him, what was the difference? And so the greatest thing about rural healthcare is those people are not afraid to fail. We're willing to try new things. We don't overanalyze it. We try it. We see if it works for our community. If it does, great. We expand on it. If it doesn't, it's real quick to withdraw from it and move on to the next thing. And no one gets executed over a failed issue. Let's try it. Let's see if it works. If it does, that's fabulous. And that's what we try to focus on. The other thing I would say with rural that's unique and often misunderstood, I think it's a lot more complex to be a CEO of a rural hospital than it is of a big urban system. You don't have that system backup for you. So if you have a risk management issue, I've got somebody that does risk management, compliance, she does emergency preparedness, and she's also a physical therapist. So you have people wearing many hats, and you have to figure out those things together, and that can make it a lot more complex. It can also make it an opportunity for more innovation because we're not stuck with, well, this is the way we've always done it. We try new things and we try to do it well. But as a successful rural CEO, you have to be willing to be able to change hats on a regular basis and move around to whatever that priority is. And it's hard. It's really
Again, being nimble, quick on your feet, thinking differently, creatively. Okay, so I'm going to start wrapping this up, but here's a tough question for you. So, maybe a leadership lesson that took you a long time to have your aha moment, or maybe even somewhere where you failed and tripped along the way, but a vulnerable share as a leader. Do you have one that comes to mind where maybe it was a lesson that you wish you learned a long time ago, or maybe a leadership failure that you learned from and you're thankful that you had that experience?
Yeah, I couldn't tell you what the defining moment was. It's just age, honestly. You realize there's very little you actually control in this life. What we control is how we respond to things. And for
Wow.
me, the big aha moment is not only is it my personal response to things, but as I sort of noted earlier on when I was talking about the community, when you're the CEO of a small hospital, everybody's watching you. Everybody's watching for your reaction. So something really bad happens or potentially bad happens. It is detrimental to my hospital if I go crazy and lose my stuff. I have to maintain a level of passion to advocate for my hospital, but I have to be in control of my emotions to help us better to respond to whatever anticipated issue comes up. Because there's so much in life that I've learned over time in the School of Hard Knocks, you just don't control. And the only thing we can control, again, is our response to those unanticipated issues that come up, because they are going to come up.
Wow, I love that. I mean, that resonates with me even as the CEO. I want to fix everything or make things better or whatever, and there are some things that you can't control and you just have to let them be, but I'm responsible for me. That really spoke to me. I love that.
And
Well,
that's right. I was going
go
to say
ahead.
that the other addition to that is you don't have to be the smartest person in the room. I
Right.
tell my group all the time, the secret to success is hire people who are smarter than you and then get the heck out of the way and let them do their job. And I
Right.
think that giving people that freedom, I think, is also very important.
I love that. And I think, sometimes especially if we feel intimidated or whatever the case may be, we want to be the smartest person in the room. And I think that just is pride. And if we can set our pride on the seat next to us and let humility take its place and ask and not have all the answers and ask more questions and listen more, it's usually a better outcome for everybody. I've learned.
There's a great saying that it's amazing what you can accomplish when you don't care who gets the credit. So it's an
Yes.
organizational win. It's not anybody's individual win. Let's all pull together.
I love that. As we wrap up, Kevin, thank you for your time. I've thoroughly enjoyed this conversation. Do you have any words of wisdom, final thoughts for our young listeners, other CEOs that I've had on the show that listen, healthcare organizations? Any final words of advice?
I think that a career in rural healthcare is an amazing opportunity, and I would encourage young folks who are in their training right now, maybe they're working on a master's of health administration, consider going to work in a rural hospital because you can truly make a difference, particularly if you're very mission oriented and you want to make a difference in the world. I think it's a perfect slot to go to. It's hard, but it's very fulfilling.
And you don't even have to leave the country.
That's right.
You can actually live here. Well, it's been a true honor talking to you, learning about your heart, your mission, and your passion for what you do. Thank you for what you do, for saving lives every day and being a part of, a small piece of that. And best of luck in your ventures and continued success. But thank you. It's been an honor.
You're welcome, April. Thank you very much. I enjoyed it.
Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.